Time has expired. Senator Scarr.
Mr Acting Deputy President, well, what an invitation. What an invitation for bipartisanship. We just heard from Senator Polley reflecting how in the past people across the chamber have worked together constructively in a bipartisan manner, and then Senator Polley gets up and gives the speech she just came. Hardly an invitation to, on a bipartisan basis, work together. And let's three preliminary points. Older Australians in this country voted overwhelmingly for the re-election of the coalition government at the last federal election. Overwhelmingly. In my home state of Queensland, older Australians voted overwhelmingly for the re-election of the coalition government. Why? Because this government delivers for older Australians. And, Mr Acting Deputy President, if you wanted to engage constructively on a bipartisan basis with the government in relation to these issues, you would not present a resolution in the nature of this one, which talks about inaction, cuts and a broken aged care system. Broken? Seriously? Does anyone really believe that our aged care system is broken? It could be better. It could always be better. But broken? The evidence just does not support this assertion. And lastly, in this spirit of bipartisanship, the reflections on the Minister for Aged Care Services, Senator Colbeck, totally unnecessary, totally unnecessary. And how can you expect to engage constructively in a bipartisanship manner with the sort of rhetoric we just heard from Senator Polley? Mr Acting Deputy President, whenever I hear the Labor Party talk about cuts, whether it be cuts to aged care services, cuts to education, cuts to health, I always know when you look at the figures, when you look at the evidence will be totally to the contrary. So what is the evidence? What is the evidence? Since the coalition government was elected, aged care spending has increased every single year. It has actually increased every single year. That's not a cut. That's not a cut. That's an increase. On average, $1 billion of extra support for older Australians each year. Not a cut, an increase. If the funding is more year on year, that is not a cut. That's an increase. Funding to aged care continues to grow, with our government investing an additional $7 billion in aged care over 5 years. Not a cut, an increase. The Morrison government is delivering record investment, not cuts, record investment across the aged care system over the forward estimates from $13.3 billion in 2012 to 2013 under Labor, growing to $21.7 billion in 2019 to 20, to an estimated $25.4 billion in 2022 to 23. And this is characterised as a cut? It's not a cut. It's not a cut. Making improvements to aged care for all senior Australians continues to be one of the Morrison government's key priorities. Our recent track record in improving aged care, including since the Royal Commission was called, is extensive. Not inaction, Mr Deputy Acting President, but action. Invested $2.2 billion since the 2018-19 budget into home care packages to support more Australians remain living in their own homes for longer. There's been a 25% increase in access to home care packages in just 1 year. Is this a broken system? Does anyone actually truly believe this is a broken system? If you want to improve the system, in a spirit of bipartisanship, maybe you could leave the overblown rhetoric and hyperbole at home. Seriously, Mr Acting Deputy President, the federal government has released 14,275 new residential care places, including 13,500 residential places and 775 short-term restorative care places. Allocated $60 million in capital grants for infrastructure works in rural and remote areas. Established a new independent aged care quality and safety commission. Implemented new consumer-focused aged care quality standards. Put in place— I'm sorry, there's a lot of actions here to read. Put in place a new single charter of aged care rights covering 14 fundamental protections for all aged care programs, from safety, quality care to independence, information, personal privacy, control, fairness and choice. Implemented new provider requirements to minimise physical and chemical restraint restraint in residential aged care, introduced a new mandatory national quality indicator program. I'm sorry, Mr President, that I have a page here of actions, not inaction, a page of actions. Provided a $320 million boost to residential care subsidies, invested $21 million for 13 research projects that will focus on risk reduction, prevention and tracking of dementia, established a specialist dementia care program, implemented an aged care diversity framework, expanded the National Aboriginal and Torres Strait Islander Flexible Aged Care program by approximately $50 million over 4 years, provided a capital grant of $20 million to establish a new aged care service for First Nations people, provided $4 million to increase aged care services to people mainly in rural and remote locations through the Multi-Purpose Services program. More actions, action upon action, provided funding of up to $3 million to engage an organisation to assist aged care providers delivering services under the NAT-SIF ACP to transition to the new aged care quality standards, allocated grants totalling $3.5 million to aged care providers delivering aged care services to Indigenous people to purchase equipment and undertake minor works. It would have been nice, Mr President, to at least have heard one word that the government is undertaking action in this sector. If those opposite truly want to engage in this process on a bipartisan fashion, then due respect needs to be given to the work that's being done in this area. Provided an additional $4 million to deliver more flexible aged care places, provided an ongoing 30% increase to the viability supplement to support services in rural and remote Australia, provided an ongoing 30% increase to the homeless supplement, given providers operating residential and home care access to independent business advisory services, provided $5.6 million in 2019-20 to implement phase 1 of a home care compliance framework. And this is what the Labor Party characterises as inaction and cuts. All the evidence is to the contrary. All the evidence is to the contrary. We all know when the Labor Party accuses a coalition government of cuts, all the evidence will be to the contrary. Increases year on year in government spending. And let's compare to the Labor record. In terms of new home care packages, these have increased, not cuts, increased, from 60,308 under Labor in 2012 to 13 to 125,117 in 2018 to 19. An increase, Mr President, 60,308 to 125,117. And then they're scheduled to increase to a further 157,154 in 2022 to 23, a 161% increase. So, Mr President, those opposite have absolutely no credibility when they bring to this chamber a resolution which talks about inaction and cuts and a broken aged care system. The people in our aged care system, the workers in that system, are working terribly hard. The system is not broken. This government is delivering for Australians, for our elderly Australians, absolutely delivering to them, and that is why at the last federal election the people in my home state of Queensland gave a resounding tick of approval to the re-election of the coalition government.
Thank you, Senator.